Did you know that cervical cancer results in 311,000 deaths annually with over $2 billion in costs globally? The majority of this impact is felt in low- and middle-income countries. Cervical cancer is a type of cancer that affects the cervix, the lower part of the uterus. It is caused by the HPV virus and can be asymptomatic in the early stages. Symptoms can include vaginal bleeding, discharge, and pain. Screening and vaccination can prevent cervical cancer. Cervical cancer affects over 500,000 female patients and causes 311,000 deaths annually, with $2 billion in costs globally. The TinyML algorithm could be trained to identify abnormal cells in cervical images by analyzing a patient's age, number of sexual partners, and other features such as biopsy and Schiller as hue. If the algorithm detects any abnormality, it could alert the user or healthcare provider, allowing for early diagnosis and treatment. AITS engineers have developed a low-code platform with templates to detect cervical cancer using AI sensor fused techniques and machine learning algorithms. The TinyML platform, like cAInvas, is a field that focuses on bringing machine learning to small, resource-constrained devices such as sensors and microcontrollers. In the context of cervical cancer, TinyML platforms like cAInvas can be used to develop algorithms that can identify cervical cancer through the analysis of features obtained from cervical screening tests. The deep learning model can be trained using various techniques such as feed-forward neural networks and other deep learning models with an accuracy of over 80%. Cervical cancer is a significant global health issue that can be difficult to detect and treat due to a lack of symptoms in early stages, limited access to screening services, and potential for false negatives, but improved awareness, screening, and treatment can lead to better outcomes. TinyML platform like cAInvas improves cervical cancer screening with 80% accuracy and makes it accessible in remote areas via low-cost devices, leading to earlier diagnoses and treatment. Following URLs are referred to in this video. Check the description for the links. Contact us.